The body's own immune system is stripping the wiring of the nervous system, and heat makes it all worse. Welcome to this explainer on multiple sclerosis. We're going to help you absolutely master this high-yield med-surg topic so you can crush it on the NCLEX. Let's get right into it.
I want you to picture a frayed electrical wire that's losing its protective rubber coating. That is exactly what's happening to the nerves in multiple sclerosis. The body is literally attacking its own myelin. You know, that protective insulation wrapped around our central nervous system axons? Well, without it, the electrical signals just short-circuit, and this leads to a huge variety of fluctuating neurologic deficits. We're talking numbness, blurred vision, and muscle weakness that kind of just seems to come and go completely unpredictably.
So how does this actually play out on a pathophysiological level? Well, it builds step by step. First off, an autoimmune attack targets the myelin right in the central nervous system. Then, demyelination happens as that myelin gets stripped away from the brain and spinal cord axons. Step 3 is where sclerosis, or these scar-like plaques, start to form in those damaged areas. Because of those plaques, Step 4 means nerve conduction is drastically slowed down or even completely blocked. And all of this results in a relapsing-remitting course. That's the most common form of MS, where symptoms flare up, they partly recover, but unfortunately, disability accumulates over time. Now, here's what's really interesting. Because these plaques can literally form anywhere in the central nervous system, the physical signs and symptoms scatter across time and space. The absolute most common symptom? Crushing fatigue. It's huge. You'll also see major visual disturbances like optic neuritis, which causes painful, blurred vision, and diplopia, double vision. Patients might also experience numbness, tingling, weakness, spasticity, and bladder dysfunction. Oh, and you absolutely need to know a few classic, highly tested signs for the exam. First, Charcot's triad. That's nystagmus, intention tremor, and scanning speech. Then there's Lermit's sign, which is this electric shock sensation that shoots down the spine when the neck is flexed. And arguably the most important one for your NCLEX, Uhthoff's phenomenon, which is where heat directly worsens their symptoms. Because the symptoms are so all over the place, we rely on a few very specific tests to confirm what's actually going on. The MRI is your absolute key diagnostic test here. It's the gold standard. It lets us directly spot those demyelinating CNS plaques right there in the brain and spinal cord. We can also use a lumbar puncture to check the cerebral spinal fluid. In a patient with MS, that CSF will show oligoclonal bands and elevated IgG levels. And that perfectly captures the localized immune activity happening right inside the central nervous system. Okay, so the absolutely crucial point for the NCLEX is knowing the villains, the triggers that cause these symptoms to flare up into an acute exacerbation. The #1 red flag danger sign is heat. Remember Uhthoff's phenomenon we just talked about? Hot baths, saunas, hot weather, even fevers drastically worsen MS symptoms. Why? Because heat further slows down nerve conduction in those already demyelinated fibers. Other major triggers to watch out for include infections, extreme emotional or physical stress, and overexertion.
When you know those triggers, our top nursing priorities just naturally fall right into place. Priority number 1, avoid triggers. We've got to keep the patient cool, avoid overheating at all costs, and fiercely prevent infection. Priority 2, treat acute exacerbations. When a flare-up does happen, we hit it with short courses of corticosteroids, like methylprednisolone, to really shorten the attack. Priority 3 is energy conservation. Since fatigue is by far their most disabling everyday symptom, we absolutely must pace their activities and plan out rest periods. Priority 4 is safety and mobility, so we're focusing on fall prevention and managing that spasticity. And finally, Priority 5 involves meticulous bladder and bowel care to prevent secondary issues like UTIs.
Now, to prevent you from falling into a classic exam trap, let's quickly compare MS to its major lookalike, Guillain-Barré syndrome, or GBS. The NCLEX loves, and I mean loves, to mix these two up. Just remember that multiple sclerosis is strictly a central nervous system attack. We're talking brain and spinal cord, and it's classically triggered by heat. GBS, on the other hand, attacks the peripheral nervous system, and it classically presents as an ascending paralysis right after a viral infection. So keep your CNS and PNS clear, and you will easily navigate these tricky questions.
All right, time to test yourself with a classic NCLEX setup. Which instruction is most important for a client with multiple sclerosis to prevent symptom exacerbation? Take a look at your options. I'm going to give you a 3-second countdown to drop your answer in the comments. Ready? 3, 2, 1.
If you chose C, excellent work. Heat drastically slows nerve conduction in those already frayed fibers. Again, that's Uhthoff's phenomenon. Because of this, we have to rigorously teach our clients to avoid hot environments, skip the saunas, stay out of hot baths, and treat fevers immediately.
Taking hot baths, like option A suggested, is a dangerous distractor that would actively trigger a relapse. Don't fall for it. Let's tackle one more highly tested concept regarding the most common symptom of MS. A client with MS reports increasing fatigue. The best nursing recommendation is to what? Lock in your answer before the timer runs out. 3, 2, 1.
The correct answer is B. Fatigue is the absolute hallmark of MS. It affects practically every single patient. Option A is a total trap. Trying to cram everything into the morning is just going to lead to severe exhaustion by noon. Grouping tasks, pacing activities, and scheduling structured rest is the ultimate priority intervention. This is what helps them maintain their independence and daily function without triggering a massive fatigue flare.
As we wrap up this explainer, I want to leave you with one rock-solid memory hook to carry right into test day. MS equals the myelin sheath in the CNS, so keep it cool. If you can remember that frayed central nervous system wire and its vulnerability to heat, you are going to absolutely crush this topic. So what other neurological mysteries are hiding in plain sight, waiting to be untangled? If this made it click, subscribe. One killer med-surg topic every day until you pass the NCLEX.